Number 4 is vocabulary. Number 5 is pronunciation. These are the 5 things that you have to search for in your speaking sessions. So you have to question yourself. You have to question with yourself, am I implementing all these things in my speaking sessions? So that is very, very important. If you're not implementing these things in your speaking, it will not be very effective. So for effective implementation, yourself, you have to involve all these attributes. Now, what is fluency? First one, what is fluency? Fluency means the way how you're speaking. The way how you are presenting. If you are not presenting appropriately, it will not be effective. Right. Now I'm going to teach you some important things. So there are 5 different things I have shown you now. Yes. Now we have the fluency, number 1. In the speaking, we're going to have the fluency. Now, what is this fluency? Now, let us see what the Cambridge Dictionary tells us regarding fluency. For anything you want, go to Cambridge Dictionary and it will guide you properly. Yes. Second one is, the number 1 is the fluency. And number 2, the accuracy. Right. Third one is the grammatical patterns. Grammar. Fourth one is the vocabulary. And fifth one, the pronunciation. These are the main components. Other than this, there are some more. Now let us see here. Fluency means what? Fluency means, this is what it is. Now you can see here, fluency means the ability to speak or write a language easily, well, and quickly. Right. Fluency is all about the ability to speak or write a language easily. okay, well and quickly. So this is all about fluency. This is what the Cambridge Dictionary says. Okay. This is what Cambridge Dictionary says. Right. So now, how to speak easily, how to speak well, and how to speak quickly. There are three components. You are speaking or writing. First one is easily. That means the ease. Okay. Number one is the ease. Number two, okay, good quality, well. And third one is the speed. So ease, good, and speed. So these are the 3 points. Swiftly you have to speak without any hesitation, without any difficulty, without any hindrance, pauses and breaks, unnecessary sounds. All these things you are supposed to avoid. Okay. So next one, second one is good. You have to speak well. You have to speak well. Well means in a fine manner. And then you have to speak very fast. Not very fast, but speed should be maintained. A necessary speed. That is what I mean. So these are very important. Now next one, what is accuracy? Accuracy means perfection. Accuracy means the correct manner. The correct manner regarding vocabulary, the correct manner regarding grammar, the correct manner regarding the pronunciation. Yes. So am I pronouncing properly? For example, there are many students who pronounce schizophrenia as a schizophrenia or something like that. So that is very important. And the third one is the grammar. Grammar is the glamour of English language. Okay. So here you have to think about the sentence constructions. Okay. Like simple, complex, and compound sentences. Different type of structures. Or you can say patterns. Don't use the same style always. Show variation. The other person who hears you should be spellbound. Next one, vocabulary. Quality vocabulary, quality words, quality. And variety is the spice of life. Variety is the spice of life. So show variation and see to vocabulary. Don't use A1 and A2. A1 and A2 are basic, the below average quality. So try to use at least a medium range. And then pronunciation. Pronunciation, try to use native accent. So the way how the English people speak. Okay, how you are going to learn these things. Native accent. Okay, the stress, the intonation, the tone, all these are very important. Stress, intonation. Okay. So these are called pronunciation patterns. The rising tone and falling tone. Okay. So these are important. So follow these things very clearly. So now I'm going to tell you what the official book. I'm going to tell you what the official poetry book is telling us. Okay. I'm going to give you some suggestions based on the official OET book. Most of you will not even think about these things, but you are supposed to go through these things. I've already given you the book. Go through that, and they will definitely enhance your skills. I'll tell you the page number also. Buy these books if possible. Black and white. The original books, hard copies. Better. Speaking. Write down the points, whichever you feel important. So this is the official book. I have purchased it. So you also can purchase these books. They're very, very excellent books. Official books. Now I'm going to tell you about speaking. So there is something called speaking. See, here it is. Here it is. Speaking. Okay. So in speaking, you have different things. Okay, what you are supposed to do. Speaking do's. Speaking do's. D-O-S. That means what you have to do. Do these things. Do what you are supposed to do. That is very important. So you are supposed to implement these things in your speaking. Yes. So what are you supposed to do? I'm giving you these points here. So this is the main point here. Yes. Now they are telling candidates should. Candidates should. Candidates should use the prompts and notes on the role play card to guide them through the role play. So there are some cues, okay, prompts, cues or notes we call role play card. So role play card is given to them and they have to use these cues or prompts or notes throughout the session, 5-minute session. You have to remember that. That is number one. So if you follow these things, it will be beneficial for you. Right. So what are you supposed to do is, in the time which is given to you, the 3 minutes, you have to prepare excellently well. So you should see what are the things you have to do. For example, if he says you have to provide a reassurance, you have to reassure. What do you mean by reassure? I have seen a number of students saying, I reassure you. What is the meaning of reassure? You don't know. Then how are you going to reassure the patient? You should understand the words in the first place. Reassure doesn't mean use the word reassure. You have to give that reassurance. That means comfort. The candidate is panicking. He is worried and upset and anxious. He is dying out of tension. He says, what will happen to me? Then you say, I reassure you, it is okay. That doesn't make sense. What do you mean by reassuring? Okay. This is quite common. Diabetes mellitus. It's not something new. For the first time it has come to you. There are a number of people facing this problem. Out of 1,000 people, there may be some 20 to 30 people suffering from this problem, from this ailment. For you, it is the first time you have come to know about it, so you are upset and worried. But frankly speaking, I have seen number of cases, and all of them are not able to manage their diabetes, and their condition is little bit difficult to manage through diet, medication, and exercise. So because they are not able to manage, the alternate option is taking insulin injections. Because the body is not able to generate. Okay. So therefore, we are asking you to take insulin injections. Number of people, those who are facing this problem, and those who are not able to manage, every one of them is going through this procedure. They're following the system. So, because of all these things, you can understand that it is very clear it's a common problem. So there is nothing to worry. So many people are managing. So why you cannot manage? Definitely you can do that. Okay. There is no other option. So if you manage these things in this way, I mean the artificial way, definitely it would be better for you. And you will not have further problems. This is called reassurance. The way how you explain things in a finer fashion, clearly, so that the patient is comfortable. Oh, so many people are there. I don't know. I'm worried about this because first time I'm seeing this. So he will feel comfort. Instead of using the word reassurance, give reassurance. Give reassurance. It is like, your son asks you, I want a toy. You say, okay, I will buy it. But another parent, he really buys and brings it. So who is better? The person who says, the father who says, I will buy it for you? Or the father who bought it and brought it and put it into the hands of the child? Who is better? I'm giving you an idea what is the best solution for this. So just telling, I will buy you the toy will not help him. He will go on crying. But the other father, he just brought the toy and put it in his hands. Now the child is very happy because he has the toy in his hands. So this is called materialization of reassurance. That means he is feeling that reassurance. Okay. You say, I reassure you, nothing will happen. How can you say nothing will happen? Explain that also, no? So that is what prompts the reassure. Reassure means this is how you have to give. Blood transfusion. Oh, how is it possible? I don't want anybody's blood. I don't know whose infection. Okay, whose blood has infection. I don't know whether he has HIV or any other problem. I don't know which infectious diseases he has. I don't want blood transfusion. Sorry, I don't want to take anyone's blood. Please, nurse, I don't want. Okay, let me survive like this, whatever it is. No problem. I don't want to take this one because I'm scared. I'm afraid. I reassure you that it is okay. Otherwise, you can say, okay, there are many emergency situations like this that you're facing. And in all these cases, Majority of the cases, 80% of these cases, you see, they lose their blood and they come with a difficult situation. So there is no other alternative but blood transfusion, because it has to be done immediately. Otherwise, he may not survive. The complications are more. So in these conditions, we give blood transfusion. But to tell you frankly, this is not for the first time you're taking. Many people are taking like this. And because of that, they are managing their blood levels. Yes. So no need to worry. All these people, whoever had accidents, they had this problem and they overcome this problem because of blood transfusion. And one more thing, why should you worry when everything is taken proper care of? There is a lot of screening done. The donor is screened properly and the blood is tested. That there are no infectious diseases or antibodies or whatever it is, harming aspects or concerns. Nothing is there. We'll see that everything is perfect. Then only we collect the blood of that person. We don't just collect the blood as it is. And after collection, we'll send it to the laboratory once again for further testing. After all this process, they will be labeled as, good ones. And only these things are provided in the blood banks. That means all the blood which is in the blood banks are excellent quality. And one more thing is, this blood may be suiting you or not. Sometimes your body may not accept that particular blood. So what we do is, we test a dose. We test it. If your body is accepting and we confirm that, then only we give it to you. We cannot transfuse blood just like that. The receiving body also is tested whether that particular blood is okay or not. And one more thing is, during the procedure, we are always there with you throughout the period. If any signs and symptoms are noticed, we are going to take immediate action, because all the medical professionals will be there. The blood transfusion will be stopped immediately and all the necessary action will be taken, so you can relax. So this is the way how you are going to present. Reassurance means this. Not say, no need to worry, no need to worry, no need to worry. It's okay, I reassure you. What are these words? What are the value of these words when you are not giving actual reassurance by giving a wonderful explanation, comforting the panicking patient? So this is what you have to understand. Screen is not clear. How come screen is not clear? Okay, let me check Anila. Hello, Anila.
Yes, sir, it's clear now.
It is clear now. Fine.
Thank you, sir.
Yes. So this is what is reassurance. So next. Okay. Now you have to know what is your role. what is your role? So your role, what is your role? Are you a charge nurse? What is your role? What are you going to do? What is your duty? Are you a charge nurse or a ward nurse or a community nurse? What is your role there? Okay, are you a family nurse? Are you a nurse in the children's ward? Are you a nurse in a maternity ward? Are you at the clinic? Are you visiting the home? What is your role? What are you going to do there? So you have to know that very clearly. What is your role? What is your duty? What is your responsibility? So you have to understand that one in the first place. This is the thing what you have to know from the role play card. Yes. Okay. Thank you. Okay. Now, next point. Now, the other way, the second one, the other side of the angle. This is now here there is the interlocutor. There is the interlocutor. So, what role is your interlocutor playing? What is he doing there? What is his purpose? Is that interlocutor who is sitting in front of you a patient? Or is he the parent of the patient? Father or mother? Or is he the interlocutor playing the role of the son who is bothered about his father or mother? Or the daughter or the care provider or another nurse, family nurse or something like that? Who is the interlocutor? First, you should know who you are. Who you are. Second one, you should know who the other person is. Is the other person, what role is he going to play? If it is the mother, then you are not supposed to talk as you are talking to the patient. That's it. You should not say the patient is struggling, because the mother will get angry if you say, if you comment his son as patient. You can say your son is comfortable. Don't say the patient is comfortable. So there are some things, do's and don'ts. You should say your son or Jack is comfortable now. There is nothing to worry under any circumstances. So that is how you have to speak. Your child, your boy, your son like that. If it is you are talking to a father, if you are talking to a son, you say, your son or Mr. Abraham is fine. There is nothing to panic. We are taking absolute care. He is in safe hands. The hospital will do everything possible to support you people. So the way how you are presenting is more important. Yes, next. Now, third one, you can see here, where is the conversation taking place? Is it at the patient's home, or is it so where is it taking place? The conversation, where is it taking place? Is it in the ward, or is it at the clinic? Where exactly is the discussion going on? You should be aware of these things. They will tell you home visit, suburban clinic, hospital, post-operative ward, or ICU. They'll say something like that. So first thing, you should know who you are. Second thing, you should know who the interlocutor is. So I can mention here the important points. Speaking do. So this is about you. So what your role is? This is regarding you. This is regarding you. And the next one is regarding the other person. Okay? The other person in front of you. So this is regarding the interlocutor. Interlocutor. And this is the where the conversation is taking place. This is the location where the discussion is going on. You should know. Next. What is the current situation? Fourth one is, what is the current situation? The current situation means the circumstances, the conditions present, the prevailing conditions. The prevailing conditions, the present conditions. Current means present. The conditions, what situation, what is the situation? After an accident, or after a surgery, or before a discharge. So what are the conditions? Burns after burning. Okay, burns after burns, or after accident, or after bypass surgery, or after total hip replacement. What is the condition? There are many stages: admission, okay, examination, diagnosis, treatment, recovery, discharge, post-discharge care. So a lot of things are there here. So what are the current conditions? That is important. Presently, what is the stage he is? Is he coming to the hospital as an inpatient? Or is he outpatient? Coming for a single visit or staying there? What are the conditions? Improving conditions, deteriorating conditions. That means not improving or improving or deteriorating. What are the conditions there? Next. Next one is, how urgent is the situation? Okay. Is it urgent or means serious or not? Okay. What is the condition? Okay. Priority basis. If it is urgent, you have to act immediately. If it is not so urgent, you can relax a bit. For example, a child has come, the mother has brought, the problem is asthma. The child is there, admitted, and the doctors are in emergency rounds. The child was brought on an emergency condition only, but he is fine now, not very serious condition. But in the other place, there are some accident. There is one accident and 4 or 5 people, okay, are there admitted, and the doctors, 2 doctors, on duty doctors, are treating those people. And now you have to talk. So you should assess the condition, then only you can be able to talk. So there are some accident cases, so the doctors are busy there. And now your condition, your child's condition is fine now, is out of danger. There are no serious consequences now. He is fine. His condition is stable. So there is nothing to worry about this. So you can please wait. The doctor is on the rounds. He is going to come any moment. So that is urgency of the situation. Priority basis. The more urgent concern should be given more importance. The next one. What background of the information? Background information. So what is the background information that is given to you? That means this is the history, maybe. He will tell you about his family history or social history, histories. Okay, background information means histories. He will tell you about his family history, social history, professional history. Okay, like this. So what are those? Try to understand. He's giving you a lot of information. He's telling you about all his problems. Okay, his habits and everything. Right. So you have to consider this one also. So you can ask the patient regarding these things. Right. He tells, I have diabetes. Yeah, I know one of my close relative, my father's sister. She also has this problem. Okay. So he will relate to those things. Next point. What are you required to do? There will be 5 or 4 bullet points. There will be 4 or 5 bullet points. In every bullet point, they will tell you, elicit information about his food habits. That means you should ask him, tell me more about your food habits. What do you eat? Okay, like that. So this is called the role. Role. So what is your role? Are you to assure him? Are you to explain him the procedure? Explain him the procedure of giving insulin injections. Educate him about the consequences if you do not, if he is not compliant with insulin injections. So this is your role. You have to give him training regarding the procedure, what he has to do, how he has to take injections, where he has to take injection. You have to give training to him. Complete training. Begin with the beginning and end with the ending. You have to take the injection like this. You have to open the vial. Then you have to break open the vial. You have to insert the needle, and you have to draw the required amount of dose or whatever it is. Yes, everything in the procedure. What angle you have to insert the injection? Okay. Where are which is the better spot? The area around the umbilical cord or the belly button is the best place to give the injection for this. But always giving it the same place will lead to some problems maybe. Because so that is the reason why you have to change, rotate the locations, the shoulders, okay, the thighs inner side or front side or back side or outer side of the thighs, where exactly. So you have to explain everything in detail. And after giving the injection, what you have to do? Should you reuse the injection syringe, or should you reuse the needle, or should you dispose the needle? Where he has to dispose the needle? And there will be a container, and the container, once it is filled, you can call us and we'll replace the container. Everything you have to speak. So this is called explaining the procedure. Then educate. He says, why should I take all these things? What are the problems? Why? What is the need for me to take all these things? He'll say, I don't want all these things. Many people are managing without these injections. So I can also try and manage. So then you have to explain him. There is no other option. This is the last option for you. Okay? Because you are not naturally able to generate the required insulin, okay, to control your blood sugar levels. So we have suggested you to follow this method. If your body is able to do, then it is well and good. But now that is not possible. So we cannot leave that as it is. And because if we leave it as it is, the condition will deteriorate and you will face further complications. And therefore, to avoid those further complications, there is no other possible option but to resort to this treatment. The doctor has recommended these things to you because he believes that this is the best option for you. And I request you to be compliant with these injections or these procedures, failing which it will be difficult for you. Okay. So all these things you have to explain. Fine. Next. Ankita's screen is not clear. Ankita. Hello, Ankita.
Yes, sir. Hello.
Hello, Ankita.
Yes, sir.
Is the screen clear?
Sir,
Yeah, is
now
the
it is
screen
clear.
clear?
Yes, sir. Now it is
Okay,
clear.
fine,
Yes.
fine. Yeah, okay, fine. Yes, yes, thank you. Okay. So next, what is the main purpose of the conversation? Main purpose, there are many roles you are doing, but the main purpose is what? So, are you fulfilling this? Fulfillment of the purpose. He is telling you to explain the procedure, find out the problem, reassure the patient, persuade him to be compliant, find out the reasons why he is not interested to take these insulin injections, reassure the patient that there is no problem if he is compliant with the medication, and persuade him to be compliant with the medication. See the four purposes here. Explain the procedure from the beginning to the end. And he says, no, I don't want to take these things. Why should I take these? All these things are difficult for me. He says, find out the reason why he is not interested to take these insulin injections. He says, no, many people, my friends also have the same problem, but they are not taking these injections. Why you are forcing me to do these things? So you find out the reason why he is against taking injections. Then when he tells the reasons, try to reassure him, saying that is not the actual problem, that if you are following these things, this is what is going to happen, and you will be fine, fit and fine. You will not face any problem in the future. That is reassuring him. Then you are going to persuade him. You are going to persuade him. This is what you have to do. This is how you have to. So persuade. So if you are compliant with these medications, then yes. One day, if everything is becoming normal and your condition becomes stable, then afterwards you may stop insulin injections. So you can say like that. It is not all your life you are going to take insulin injections. If everything, sometimes it may come back to normal, and that time we'll suggest, after a review, we'll suggest you to stop these insulin injections and go back to the normal medications. So here we have four different things. One is the purpose. So you should know what is your purpose. The first one is explain. You have to explain the things to them clearly. So explaining is the purpose. Number one. Next one, discovering something, finding out. Ask him why, and he'll give you the answer. Why are you not taking medication? Then he will say, there is nobody to help me. I'm getting food from Meals on Wheels, and I'm getting from the local restaurant, and that is why I'm facing this problem. So find out the reason why he is non-compliant to dietary regimen. Nobody is there to cook according to the requirement what you have said. So that is why I'm taking as it is. What I can do, I have no other option. At least I'm eating. That's all. If I don't eat, then what? How can I do? There's nobody to cook it without less salt and less spicy. So there is nobody to prepare for me. So what I should do? Then reassure. Reassure means, okay, no worry, you are in safe hands, everything will be fine. So if you follow these measures, the condition will become normal and you can manage your life. All these things you can say. That is reassurance, what I have explained. Then persuade him. Persuade him. Persuasion means make him convince him. Convince him. If you do explanation, then afterwards finding out the reasons for non-compliance, then reassure him, okay, that everything will be fine, and persuade him to be compliant. So all these things go together. See, these four things are the main parts of the every speaking session. These four things are the main parts of every speaking session. For example, you are giving diabetes injections. You are going to explain these diabetes injections. Sorry, insulin injections. Then what you have to do is, the first step is you have to explain the procedure. Number one, first build up the background in the first minute. Then explain the procedure in the second minute. Find out why he is not interested in the, no, I am afraid to take injections. I never took injections in my lifetime. And you know, something goes wrong, who will bother? You tell me that I have to take the injections on my own. How is it possible? I am not a medical professional. I am not a nurse. How can I take? All these things he will give you excuses. So now you can give reassurance now. You can tell him everyone is doing like this. There are majority of the people who are in the same condition. Every day they cannot come to the hospital to take this injection from the from the nurses. So they are taking on their own and they are managing. So no need to worry. I will be with you for 2 or 3 days. Okay, or for the first week I'll come and explain you everything. Then afterwards you'll get habituated and you can do it normally. So this is called reassurance. Then afterwards persuade him, convince him that he should be regular. He should do it always without any break, because nobody is watching him or supervising him. So he has to, for his own benefit, for promoting his own health. All these words you can use. Whatever I am telling you now, you can use there. For the best interests of your health, you are recommended to do these things. Because doctor has told you. So that means there is no other option. Right. After careful study, after careful analysis of your problem, is coming out with these solutions. This is how you have to speak. Right. Next. Okay. Okay. Come. So next. Next one is right. What other elements of the situation do you know about the example? Patient appears nervous, he's angry, he's upset, he's disturbed, he's tensed or worried. Okay, and you don't have time, you are busy. What are the other things? Other important elements. Other important elements. Yes. So what are those things that you have to consider still? So now sometimes, you know, nurse, doctor, please give me these tablets. Because my father, you know, he took these tablets from my sister and he slept peacefully, and all night there was no problem for him. I want these tablets. Please give them to me. I want to give it to my father. He is 70 years old. He cannot come for those tablets. Please give it to me. And you are just 25 and you are busy. You want to go to office, take these medications and give it to your father, and you want to go to college, or okay. You are his grandson maybe. And you tell, and you are a nurse and you say, no, I cannot give. Why you cannot give? It is good for my father. Give it, please. I want it now. I cannot wait. I cannot bring my father. I want it immediately now. I don't wait. I'm busy, very busy. He will start shouting at you. Then how are you going to? This is called psychological problem. He'll be only shouting. Okay. Then how are you going to sort out these issues? These are extra. This is out of the subject. This is situational. Reluctant patient. I don't want to take participate. I don't want blood transfusion. I don't want to take insulin injections. I don't want to undergo surgery. It's okay. I don't want to take. I don't want this dialysis. Then what will you say? He's not interested. I have been waiting for you for 1 hour. You are coming to me now. He'll be shouting at you, and you are all the more busy there. So how are you going to deal with these people? So you have to be very cool and relaxed. You should not panic. You should make them understand. Tell them the situation. Okay, I totally agree with your situation. You have absolute right to be angry. There is nothing wrong. But let me tell you, please, let me explain you. This is the condition. The doctors are busy in the emergency ward because there are 5 patients in serious conditions. And there are only 2 doctors and they are attending them. But let me tell you, your daughter is stable. Her condition is stable now. And I am there. No, what will you do? Call the doctor immediately. I don't want to wait. Why? My daughter is not important for you? Yes, my dear. For her, daughter is important. For the mother. Okay? For you, everyone is important. But for her, her daughter is important. Please sit down. I need to talk to you. Because this concerns your daughter. I realize that your child is very precious to you. And so she is to us. She is equally important. And we are not neglecting your daughter. I am going to check her vitals now. If it is emergency, and I'll get the doctor immediately. But now you look, your daughter is stable. She is fine. Okay? And the doctor will be back here within 10 to 15 minutes, the maximum. So until then, I am with you. I'm going to check the vitals and prepare the ground ready for the doctor. And I'll take all the measurements and other things, vitals, and keep them ready so that the doctor, when he comes, he can start action. Otherwise, the doctor has to wait until I get all these things. These are preliminary procedures. So with your kind cooperation, if you give me permission, I will go ahead with the vitals. Will you please give me permission? So this is the way how we are going to talk. Then next one. Okay. Last one. These are the do's. All right. Yeah. So what information do you need to give the patient? Now you have to give feedback to him. You have to give information to him. You have to give him some treatment or whatever you have to provide. This is not a test of your professional skills. Don't think that you are a nurse and you have to give everything related to nurse. No, those are not tested. The English language is tested. He's telling you, see here, this is not a test of your professional skills. He's testing you how well you are using English. Okay. This is linguistic excellence, not professional, not professional knowledge. He's not testing your professional knowledge. He's testing you how you are using your grammar, your vocabulary, your pronunciation, your styles, your sentences, all these things. If you are going to do here and there little mistakes regarding that procedure, no problem. He will not bother much about that, because OET is not a professional test, medical professional test. It is a language test. Remember that. That is what OET says. You have to know that. So you are tested for linguistic excellence, not professional knowledge. So don't worry if you miss in that area a little. So you concentrate more on language components. You concentrate more on language components. Right. So what are those things? So you prepare a background, organization. What should you ask first? After explaining the procedure, you will not ask, oh, how do you feel? How did you feel yesterday? How is your condition? First you ask, how is your condition? Okay. What are your opinions regarding this? Then afterwards only you. First what, then that only you have to take. Okay. Don't give your directions first before asking him. For example, you say, don't directly say, you should minimize alcohol consumption. You ask him, how much alcohol do you consume per day? Then you explain him, this is the required amount, acceptable level. Then you say, because your level is beyond that acceptable norms, so you are suggested to minimize. So that is, this is the step. Level 1 is find out his level of consumption, alcohol consumption, how much he is drinking. Then tell him what is the accepted level. Okay, how much his body can take in the normal sense. Then tell him that the level which he is consuming is more than the accepted level. Okay, reason. Then tell them because of this higher level, you have to reduce. Then lastly, tell the consequences if he doesn't reduce. Okay. So this is the these are the 5 steps you can. So this is called organization. Organization, practice makes a man perfect. Yes. So these are the do's. These are the things which you have to do. I have explained too many things. Okay, I have explained too many things. Now I want you to implement all these things. Prepare, instead of 3 minutes, you prepare 5 minutes, no problem. 10 minutes you prepare, no problem. When you are coming to a test for me, that time only 3 minutes you prepare. But when you are going with the trainers, assistant trainers, with them you can practice and go. Practice well. Listen to the others' audios. There are many audios I have posted in the Telegram channel. So you can go there. This is the Telegram channel, not the classical corrections. There is another Telegram channel, seriously speaking. Okay, this is the Telegram channel. You can click on this one. This is the Telegram channel. You can see the number of audios here. Okay, you can see here how many audios. The latest one is 373 Vidhyas. Before that, Maria Margaret, 372. Okay, this is Vignanaj Prabjit. Prabjit's audio is here. See here, you can play here. And you can listen to it, how they are speaking. Every candidate might have a different style. Okay, Every candidate might have a different style, different quality of sentences. You can use them. So that is, I'm going to post it here. I'm going to post it here. This is the link. Sorry, 1 second. This is the link, channel link. Go join there. Okay, click on that one. It will take you directly there. Then you say subscribe. Subscribe. Fine. So then you will get all these things there. Okay, just click on the subscribe channel, the link which I sent you now, right now. Then you will go there. Then you say subscribe. There you can find all different types of audios. Okay, then you can listen to them, how others are speaking. Practice those. Be ready till your speaking turns comes. So today I explained you about the do's. Now, tomorrow I will explain you about the don'ts, what you are not supposed to do. And what are the other things which are important here. All the other things I will explain tomorrow. Okay, I will explain tomorrow all the other things. Okay, so 3 days session this is. So morning I will be taking speaking tomorrow again, same time, 10 o'clock to 11 o'clock. Not on the timetable. 10 o'clock tomorrow. Again, I'll take the second round of speaking. What you are not supposed to do, what you should do in the role play, what you should not do in the role play, and how to use the speaking practice test, how to practice. Okay, speak as naturally as possible. Now, till now, I have taught you about the role play. Do the role play tomorrow. How to do the role play. I told you now what are required in your role play. I taught you now. But tomorrow I'll teach you how to participate in the role play. So how to speak, okay, how to practice, okay, how to read, how to implement, how to ask questions, how to analyze information, how to rephrase those words and give it back to him, okay, how to fine tune the sentences, what sort of grammatical concepts you can use there, how you can use simple, complex, compound sentences. Okay, now I want to mention here. Okay, I want you to mention here. Okay, fine. I want you to mention in the box. Now, tomorrow morning, I'll be taking, yes, if anybody has morning duties, you can watch from the YouTube, no problem. Okay, any personal questions, I'm there to explain you. Because from morning to evening, something or the other, I'm starting the sessions now, more sessions. Okay, because now I have some assistants. So they are going to depute me. They are going to reduce my burden. So I'm going to take those things, more important things. So what you are supposed to do is, and one more thing I'm telling you, if you don't take speaking sessions today, you also, trainers, if any student doesn't come for speaking session to you today, okay, from morning 8 o'clock till evening 6 o'clock, you're there. They're not able to give you 5 minutes. So tomorrow, don't listen to them, please, because everyone has time frame. So don't take. If you don't take today, tell them. Okay, talk to Simon sir. Fine, I'm giving them. Okay, so what you have to do is, you have to do the speaking test from now onwards. Don't, they are also, they are also burning in a furnace, one by one, one by one, one by one. So don't trouble, be waiting patiently. In the meantime, you can do reading, you can do listening, you can do writing, you can do speaking, and you can do practice, you can do other things. Okay, we are giving you an opportunity, make use of the opportunity. If today you don't take speaking, that means you are not interested in taking the speaking. So tomorrow, don't go back to them. They are there waiting for you. They are appointed for you because you are important. And if you disregard this opportunity today, that opportunity will be taken back and you will lose that opportunity. I'm telling you. Okay, if you practice with them, then you can come and practice with me. Last option. Yesterday, I was waiting till evening and nobody did 2 speaking sessions. Lastly, they are coming and asking me, sir, take my speaking. Why should I take for you when you are ignoring that till evening and I have to tell you, come on, take. Please follow those things and implement them very clearly. I'm telling you. Okay, now Tomorrow's session, today's session is about the role play. Tomorrow's session is during the role play. That means tomorrow's session is during the role play. How many of you are interested? Interested candidates say yes. Interested candidates say yes in the chat box. Okay. You did not ask for me all these things, but I'm giving you. So come and learn. Every day, morning, 10 to 9, I'll take speaking session. Evening, 8 p.m., I'll take writing session. Write down the timetable. Morning, 10 a.m., speaking session. Lecture with Simon. Evening, 10 o'clock, writing session. Afternoon, 4 o'clock, 4 p.m., listening session. Night, 10 o'clock, reading session. This is the timetable. Okay. So morning, this is for the regular students, all the regular students. You should not miss. Morning, I'm coming, Sabita. 1 second, please. Morning 10, morning means, okay, 10, that means 1,000. 2 minutes, Vincent, just 2 minutes. 1,000 hours. 1,000 hours. Indian Standard Time. This is speaking every day. Then next one, 1,400 hours. Indian Standard Time. It is listening. Okay, then next one, 8 o'clock. 8 o'clock. Yeah, 8 o'clock means 2,000 hours. 2,000 hours. That is writing session for the nurses. Every day. Every day I'll teach you on writing. Every day I teach you for writing from the beginning. How to select the information to how to check your information. The next one, 2,200 hours. IST reading session. Because reading session I'm giving you in the evening because it is writing and reading are the toughest. Writing and reading are the toughest. So I'm giving in the evening time so that all of you will be available. Speaking and listening are easier. So that's why I'm giving in the morning. So I hope you understand. Yes. Who is that? Sylvia Joseph. What is the name? Bensi. Who was that who raised the hand? Yeah, Sabita Jose. Sabita Jose. Yeah, Nusrat, I'm coming to you. Hello, Sabita. You are saying something. You raise your hand. Do you have something to say, Sabita? You can unmute. I'm giving you a chance for everyone to unmute. Sabita, you can unmute. Yes, do you have any questions, Sabita? Sabita Jose, do you have any question to ask? Hello?
Hello?
Okay, if you feel you want to ask personally, you can take my WhatsApp number. Yes. Okay. I'm sending you my WhatsApp number. Okay. So these are regular sessions. So the new students don't know about these regular sessions. So if you feel hesitation to ask me, you can ask me personally, no problem, because you are newcomers. No? So that's why if you have any doubts, you can ask me here. So this is my WhatsApp number, copy link, and here is my WhatsApp number. Sorry. Everyone. Yeah. So this is my WhatsApp number. You can message me there and you can talk to me. Next to Nusrat. Nusrat raised your hand. Yes, Nusrat, you can unmute, please.
Hello, sir. Good morning.
Hello, good morning, dear. I'm sorry. For your sake only, I have put reading and writing in the evening. You understand, like you people, because most of you are facing problem in reading and writing, correct?
As well listening, sir.
You want only listening?
No, listening also, and these two of them also.
Okay, no problem. Then listening you can watch from YouTube. Others you can attend direct sessions. Is that okay for you?
Yes, sir, but how about speaking? Because speaking, you said it's always in the morning.
Yes, sir. Speaking, of course, speaking is not that much. No, reading is too much problem. So that's why I'm giving in the evening. Okay,
Yes, sir,
no
I
problem.
know, but
Sometimes,
I need. Yes, sir,
sometimes
I know, but
weekends. Okay. I'm coming to you. Weekends, right on weekends. Weekends, I'll change the shift of Saturday and Sunday. Okay.
for us, the weekend is the Friday only.
Okay, weekend is Friday. Okay, no problem. We'll do something else. Okay, Friday full, I will explain. And any holidays you have, that day I will explain in the evenings. Okay.
Okay, sir. Okay, sir. Thank you so much. Thank you so much.
Definitely. Okay, fine. Right. So I want you to give me your feedback regarding to your today's session. Feedback, please. Feedback. Please. Yes, Nusrat, again you raised. Come on, tell me something.
No.
What do you...
No, sir, it's by mistake.
Okay, no problem. You can remove that. Your feedback, please. Write in 1 or 2 sentences your feedback. Give me your feedback, please. Write in 2 or 3 sentences about your feedback. How do you find? Do you find it interesting, nice or not? Do you want more sessions? Whatever you write here, those you will get. For example, if you say the explanation is not good, so what I will do is I will stop giving explanations. If you say that we want more explanation, then I will give you explanations. If you say explain reassurance something, then I will explain about that one. Whatever your doubts are, requests are, whatever you want, that I will explain you there. So write down your comments, because based on your comments only, I will explain you more.
The plan, like we said, plan is wrong. There's some TV only limits. Yes. Okay. Shall this present running?
So, yes, our students are going for the exam on the 24th. So we have almost 7 students are going for the exam on the 24th. So more places are being opening. So if anybody is interested, you can contact me on my WhatsApp number. So there are 7 students going for the exam. So 7 places are becoming vacant on the 24th. So you can register. Anybody who is interested, you can register. Any new students are there, you can register. Only 7 places are there, not more. Yes, Bensi, you are asking me. Yeah, this is how, if you give something, I'll give you. So Bensi says, please explain reassuring words. Okay, reassuring words, they are not words, my dear, they are sentences. They are paragraphs itself. You have to speak 4 or 5 sentences to reassure a person. Not just I reassure you. For every different thing, different. I'll give you the format for that one. It will be a format. Okay, and you'll remove that one. Instead of diabetes, you will say blood transfusion or something else. So format is the same for everything. You can alter the words, you can change the words, and you can implement those things in your speaking session. Okay, I'll give you all those things. So try to implement. Now what you do is, don't directly go for the speaking session. Try to think about this one. 15 minutes, prepare well. So lastly, when I take the session, I will give you another session. So lastly, when I take the session, in that session, you will be perfect. So prepare well, instead of 3 minutes, take 15 minutes, no problem. Try to make notes, try to improve something. You practice on your own. Then afterwards, yeah. Any requests are there? Anila says, we want more sessions. Very good. Anila, I'll give you more sessions. Daily I'll give you. Then please explain about sympathetic tones. Vijnana Jyoti, very good. I will do that one. Make a notes of these things. Okay. Afterwards, sympathetic tones, then reassurance words. Okay. Then usual mistakes, common errors. Okay, what we do? Listen. It is okay. No need to worry. These are common sentences everyone uses. So those words you have to avoid. Okay. Sylvie Jose. Thank you, sir. Interesting, excellent explanation. No one is giving this elaborate class. Okay, thank you very much. I'll give you more and more. Come regularly when I will give this option. Sometimes I'll give free sessions. You can always come. But if you want regular sessions, you have to contact me. Because, okay, fine. Anyhow, now there is an opening because normally my seats will be always full. Okay. So if anybody is interested, you can come. All right, no problem. You can contact me personally. Okay. Because before 24th only, all my seats will be booked. Okay. Post this precious recorded session, if not YouTube. Yeah, it is there directly posted on the YouTube, Jyoti. Hello, Vijnana. Vijnana Jyoti. Hello.
Yes, sir.
Yeah, it is posted directly into the YouTube. Okay.
Okay, sir. I'll check, sir.
It is posted directly in the YouTube. No worries. Okay, fine. Right. 1 more minute. Type it out and post them. I'm closing the session and we are going to start the speaking sessions. Thank you, sir. Very effective class for me. Please help all the modules. I'll definitely help you. Contact me on my WhatsApp. Sabitha Jose. Very good. So once again, for the new students, if anybody is new, there is now opening. Okay. Bensi. Then next one, Sabita. Yeah. So there are 7 openings for the 24th. If anybody is interested, you can get back to me. Right. But my sessions will be serious. If you are really serious, only come to me. Not because you are paying, I will teach you, but if you are really serious, I'll teach you. That is the thing. Okay. Right, fine. Ankita. Thank you so much, sir. We have learned more and more. Okay, not just learning, try to use them in your speaking sessions when you are practicing with the assistant trainers. And because in the after finishing all these 3, I will take your speaking. Okay, in that speaking, you will definitely prove improvement. You will show the improvement there. Definitely, you will show there. Right. Next one. Fine. Lalita and Vijnana Jyoti. Yeah, I posted it for if not for regular students. Yeah, I have already posted for regular students there. It was an excellent speaking session. Now I can reassure the patient without any hesitation. Thanks a lot, sir. Wonderful, Vidya. You'll do excellently. You're going for the examination. So today you will have 2 speaking sessions with me, one in the afternoon and one in the night. Don't go to sleep without taking 2 speakings from me. Okay, if you go to sleep without taking 2 speaking sessions from me tomorrow, don't call me only. Okay, right, right. So in order to take 2 speaking sessions from me, what you have to do is first you have to take the speaking session with Tara, then with Jisa. Once you take these 2 speaking sessions, you will be eligible to take with Krishnan. Then once you take Krishnan, then you'll get 1 speaking session with me. And if you do that speaking session, you'll get another speaking session. Whoever is going for the exam, these are the things. Fine. Is that okay, Vidya? What are these conditions, sir? Hello, Vidya. Hello. Nalla irkingala. Vidya.
Hello, sir.
Hello, Vidya. Nalla irkingala.
Nalla irukken, sir.
Simon sir will make me mad. What is talking? He's telling something the condition. Nobody in the world could put me in these conditions.
No, it's not like that, sir. You are one and only the person encouraged for us like that.
I have seen the craziest person in the world. You may be thinking, no problem. You get your excellent result and I'll give you 1 photo chance with me. Okay.
Definitely, sir. Definitely.
Right?
Okay, sir.
You should get the A grade or at least B grade. And who else is going for the exam? Raise your hands here. Yes, Pavitra. Pavitra,
Hi, sir.
unmute. Hello.
Hi, sir.
I will shoot you. If you don't take 2 speaking sessions, I'll shoot you with a camera, okay?
Sir, I'm ready, sir. I'm ready for 10 speaking also right now, sir.
Oh, I will die only then. Okay, no problem. You also have the same option like Vidya. Then next one, who is the other one going for exam? Prabjeet, unmute.
Hello, sir. Good morning.
Hello, Prabjeet. How are you? You are also going for the exam, okay? Right?
Sir, my exam on 7th August.
7th, okay. So don't come. Only one speaking for you.
Okay, sir.
Okay, I will shoot you, okay? If you come for the second session. Okay, fine. There's a when we were children, no? When my son was a child, he used to come and tell me, "Daddy, I'll shoot you." What nonsense! You will shoot me with what? Do we have a revolver? No, Daddy, with a camera. And he'll smile like that. Okay, I will shoot you. Okay, if you come for the second speaking session, one speaking session is enough. And who else is going for the exam? Okay, Anila. Yes, Anila. Unmute.
Yes, sir.
Yeah, you also can have 2 speaking sessions, but you know the condition. First Tara, then Jisha, then Krishnan, then Simon sir 1 and Peter sir 2.
Okay, sir.
There are 2 people, Simon and Peter. Simon is 1 and Peter is 2. I am double. Okay.
Okay, sir.
We agree or no?
Yes, I agree. Full condition.
Okay. The next one. Who is the next one? Anybody else who has exam on the 24th? Okay, fine. That's it. Yeah, Ankita. Yes, you have 4 speakings. Yes. All of them do in an order. First to go to Tara. Okay, then go to Jisha, then go to Krishnan, and then go to Simon sir. Then lastly come to Peter sir. Okay, bye-bye. Have a nice day. See you all. Oh. Okay, nice. Select all. Okay. Select all. Okay. Select all. Copy. Yes. Thank you for making this session a grand success. What happened?
Great singer also.
Singer, dancer, all in